In this video, we'll review skull imaging, focusing on CPT codes, standard radiographic views, and a sample radiology report to help you understand how to interpret and code this exam accurately. When coding for radiographic examinations of the skull, the following CPT codes are most commonly used. 70250, radiologic examination skull, less than 4 views. This code applies when 1 to 3 views are taken of the skull. 70260, radiologic examination skull, complete, minimum of 4 views. This is used for a more comprehensive exam, typically including at least 4 standard projections. 70240, radiologic examination sella turcica. This is a focused study of the sella turcica region within the sphenoid bone, which houses the pituitary gland. Here are the most commonly performed views for skull imaging. The choice of views depends on the clinical indication and the anatomical structures being evaluated. Skull PA view, skull AP view, skull lateral view, skull AP axial town view, skull PA axial, Caldwell view, submentovertex view, SMV, Schuller's method. Skull Waters view, skull, reverse Waters, skull axiolateral, Stenvers, skull axiolateral, modified Stenvers view. Skull axiolateral oblique, Arcelin method, skull styloid processes axial, Cahoon method, sella turcica lateral. Let's look at a sample report for CPT code 70250, skull, 2 or 3 views. Header, AP and lateral views of the skull. History, lesion of the skull. Prior CTs showed bilateral thinning of the parietal bones. Comparison, CT from June 4, 2021. Findings, no evidence of fracture or malalignment. Facial bones are unremarkable. Symmetric focal bilateral thinning of the posterior parietal and frontotemporal bones. Dental amalgam noted. Impression, symmetric bilateral calvarial thinning, likely representing focal idiopathic calvarial thinning, also known as biparietal osteodystrophy, no suspicious osseous abnormality. This report supports CPT 70250 due to the documentation of less than 4 views. The correct ICD-10 code for this report is M8589, other specified disorders of bone density and structure, multiple sites. This code is used to report abnormalities in bone density or structure that don't fall into more specific categories. In the context of the report example, symmetric bilateral calvarial thinning, likely representing focal idiopathic calvarial thinning, also called biparietal osteodystrophy. The finding describes a non-traumatic, symmetrical thinning of the skull bones, which represents an unusual but benign variant of bone development or structure. If the radiologist specifically states this is idiopathic calvarial thinning and there is no known underlying cause or associated syndrome, then M8589 is most appropriate. If the thinning was linked to another diagnosis, like metabolic bone disease or trauma, you'd code that underlying condition instead. Although CPT code 70240, radiologic examination sella turcica, remains a valid billing code, this exam is rarely ordered in modern clinical practice. Here's why. Superior imaging options, MRI, CT, low diagnostic yield on X-ray, evolving standards of care in endocrinology and neurology. Medical coders should be cautious when assigning this code and ensure that documentation supports both medical necessity and lack of better alternatives. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content.